Hi everyone! Welcome to another episode of the online educational series of PNU, where learning is a lifelong process. This is the PNU Talks. Good day to all the viewers. I'm Rommel Alegre Jr. and I'll be your learning from home buddy for this episode entitled The Nurse Teacher in the Hospital. I'm a registered nurse and a licensed professional teacher. I earned my bachelor's degree in nursing in 2011 and got my nursing license in the same year. I completed my academic units in the Philippine Normal University Certificate in Teaching program in 2017. I also took my reviews in the same university and got my teaching license in 2018. Currently, I'm a master's student of PNU, specializing in curriculum and instruction. I'm also one of the nurse educators of a tertiary hospital in Makati City. Before we start our episode, please make sure to like and follow the official Facebook page of PNU and to tune in to all the episodes of PNU Talks. Write down your comments, questions, clarifications, and suggestions in the comment section down below. With that said, let's go to the hospital.
We just arrived in the hospital through the employee's entrance. We just had our temperature checked, our shoes dipped in the shoe bath, and our hands sanitized. But why do we have to deal with all of this? Why are we in community quarantine? Why do we have to use alcohols and sanitizers? And why do we have to take a bath every time we arrive home? You might be wondering, oo nga no, bakit nga ba? And some of you will answer, kasi sabi ng doktor, sabi ng DOH, guidelines ng WHO, ng CDC, etc., etc., etc. But actually, there's an underlying notion to them. And that notion is what I want to share with you in this episode. It's a very simple concept that can easily be understood by anyone. Us in the healthcare profession is practicing it in a daily basis. I hope that once I share it with you, you will have more understanding of what is happening with the pandemic crisis and the reason why everything is in place. And I hope after watching this episode, you will go around and spread the facts, but not the disease.
The concept that I want to share with you is the concept of the chain of infection. The chain of infection is a sequence or series of events that ultimately lead to the spread of infection and the spread of diseases. It is composed of 6 links that have unique and specific roles. The condition of these 6 links must be present and perfect for infection to occur. And in order to stop the spread of infection, we must break the chain. The good news is the chain of infection can easily be broken or interrupted with the correct intervention. The 6 links that compose the chain of infection are the pathogen or the causative agent, the reservoir, the portal of exit, the mode of transmission, the portal of entry, and the susceptible host. The first link is the pathogen or the causative agent. It is the microorganism that can cause a disease. It can be a bacterium, a virus, or a fungus. In order to break this link, we must use sanitizers and disinfectants, we clean the environment, and we immediately seek consult whenever we are sick or not feeling well. In this current situation, we also avoid unnecessary travels outside our homes. The second link is the reservoir. It refers to the environment where the microorganism can live and thrive. It can be humans, animals, the soil, the water, or any inanimate objects such as the tabletops, the doorknobs, or your cell phones. In order to break this link, we must clean and eliminate the reservoir. For humans and animals acting as reservoir, we cannot eliminate them. We instead quarantine or isolate them. Side note, quarantine and isolation are almost the same, but they differ in different concepts. Both of them requires limitation in movement and contact. For quarantine, these are people who have been exposed to the disease but not yet sick. For isolation, these are the people who are already sick. The third link is the portal of exit. It is the way how the pathogen leaves the reservoir. It can be in the form of a bite, a sneeze, a spit in the urine, in the blood, in the feces, and any other body fluids. To break this link, we cover the portal of exit by properly dressing the wound and by covering faces whenever we sneeze or cough. If it is not possible to cover the portal, then we correctly use personal protective equipment or PPE and we clean our hands. The fourth link is the mode of transmission. This is how the pathogen is transferred from one to another. Among the 6 links of the chain of infection, this is the easiest to break or interrupt. There are 5 modes of transmission that we must know. The contact transmission through touching, the airborne transmission through inhalation, example of which is tuberculosis and chickenpox. The droplet transmission through saliva and spit and other body fluids. An example is measles. The vehicle transmission through inanimate objects. Example is hepatitis through food and HIV through needles. And the vector-borne transmission through carriers such as insects. Examples are dengue and malaria. Since this is the easiest link to break, we interrupt this through cleaning our hands, using the proper PPE, we observe physical and social distancing, and we properly handle our food and water. The fifth link is the portal of entry. This is how the pathogen enters the new host. In most instances, how the pathogen leaves the portal is how they enter it. It can be through a form of a bite, through inhalation, through eating, or through an open wound. Just like the portal of exit, the portal of entry is mostly the same. To break this link, we cover the portal of entry by properly dressing the wound, and by covering the faces whenever we sneeze or cough. If we cannot properly cover the portals, then we correctly use the personal protective equipment or PPE, and we clean our hands. The sixth and final link to the chain of infection is the susceptible host. This is the new person being infected by the pathogen. We break the link to the susceptible host by boosting our immune system through eating healthy, taking vitamins and minerals, exercising, getting vaccinated, and cleaning our hands. Having discussed the chain of infection to you, let's apply it to some common infectious diseases here in the Philippines. Let's take dengue first. The pathogen for the dengue disease is the dengue virus. Its reservoir is a female Aedes aegypti mosquito, who in turn breeds in stagnant water. The portals of exit, entry, and the mode of transmission is the mosquito bite. And the susceptible host is the bitten person. The best way to break the chain of infection of dengue is to eliminate the breeding ground, thereby lowering the chances of the proliferation of the population of the mosquito. We do this by preventing the water to stagnate and to clean the drainage systems. For us humans, we must wear long pants and to prevent biting as well as killing the mosquitoes. Another example is tuberculosis. The pathogen is the bacteria Mycobacterium tuberculosis. The reservoir is the human lungs. The portal of exit is the mouth and nose through coughing, sneezing, and breathing. The mode of transmission is airborne, as the bacteria is so small that it can be suspended in the air. The portal of entry is the mouth and nose through inhaling. And the susceptible host is the person, both healthy and unhealthy. According to our doctors, healthy persons don't typically get affected by TB, but unhealthy persons who get infected are those who have weak immune systems and they are typically affected. The best way to break the chain of infection in TB is to target its mode of transmission. We isolate the patients in special rooms in the hospital called isolation rooms. Healthcare workers wear N95 masks whenever they talk to these patients. Administering anti-TB medication is also crucial as the medications can help the person fight the bacteria, rendering the bacteria non-contagious after a series of time in the medication. And most importantly, we keep the population healthy by administering vaccines to newborn babies. And lastly, we tackle the current pandemic crisis, the COVID-19. The pathogen is the coronavirus, more scientifically and medically known as SARS-CoV-2. The reservoir is still unknown. Scientists and experts are still studying the nature of the virus and its disease. The portal of exit is the mouth and nose through coughing, sneezing, and breathing. Sometimes they also consider skin-to-skin contact. The mode of transmission is believed to be contact and droplet. The portal of entry is the mouth and nose through inhaling. And the susceptible person is the person who inhaled the virus. In order for us to eliminate COVID-19, we must remember that viruses are self-limiting, meaning if they have been prevented to spread, they will eventually die on their own. It's as simple as that. To let the virus stop itself, then we target its mode of transmission. We isolate the patients, we wear proper PPEs, and we wash our hands. And most importantly, we must follow strict physical and social distancing. At this juncture, you might be wondering whether or not you need to study or have an in-depth knowledge and understanding on how doctors, nurses, and healthcare professionals prevent infection. But actually, there are only two simple procedures that actually prevent infection in the hospitals and in the community setting. The first is hand hygiene. Hand hygiene is a collective term that describes the act of cleaning the hands. It has two types, hand washing and hand rubbing. Both techniques use the same steps, but they differ in time and the medium you will use to clean your hands. Hand washing is done through the use of water and soap, while hand rubbing is done through the use of alcohol-based hand sanitizers. Hand washing is longer at 40 to 60 seconds, while hand rubbing is shorter at 20 to 30 seconds. This is the proper technique of hand hygiene following the hand washing steps. Initially, wet your hands and use your desired antimicrobial soap. The first step is to lather the soap palm to palm. Second, rub your right palm over the back of the left hand, then vice versa. Third is to do palm to palm with the fingers open or interlaced. Fourth is to interlock the back of your fingers over the palm of the opposite hand. Fifth is do rotational rubbing of the left thumb inside the closed right palm and vice versa. Sixth is to do rotational rubbing of the clasped fingers of the right hand over the left palm and vice versa. Open the faucet using your elbow or arms or ask somebody's help. Rinse your hands ensuring that either hands will not touch each other, the sink, or the countertop. Do not shake your fingers and just let the water drip. Close the faucet and use clean cloth or tissue to dry your hands. Use alcohol-based hand sanitizers for hand rubbing following the same step. Palm to palm, right palm over the back of the left hand and vice versa, palm to palm with fingers interlaced, interlocking fingers over the opposite hand, right thumb over the left palm and vice versa, and rotational rubbing of clasped fingers over the right palm and vice versa. Then let it air dry. And the second is the use of personal protective equipment. For the purpose of this episode, I will only discuss masks, face shields, and gloves. This is the proper way of wearing surgical mask. Hold the mask over the ear loops with the colored side facing outwards. Pinch the metal on the nose bridge and pull down the mask to fully cover your face. If you are going to use a secondary mask such as an N95 or a cloth mask, make sure it is on top of the surgical mask, just like this. Ensure that both masks are covering your face to fully protect yourself. If you are going to use a face shield, ensure that it is the size that fits you. To remove the face shield, simply touch it in the inner part and do not touch the outer part exposed to other people. Then, place it on a separate area before you reuse or wash it. Remove the mask using the ear loop and gently pull it away from your face. Carefully fold the mask outward without touching the outer part. Fold it halfway until it is small enough for the ear loops to be wrapped around. In this way, we will contain the dirty outer part of the mask. Get a tissue or a paper and wrap it before throwing it in the trash bin. Wrapping it will help prevent the spread of infection. The gloves must be used properly and primarily only for handling body fluids and known contaminated objects. Do not wear it when you go out and touch everything that you want. In fact, that practice will aggravate the spread of infection. Simply bring and use sanitizers and disinfectants and avoid touching unnecessary things. To properly wear gloves, choose the right appropriate size for your hands. Ensure that it fits snugly on your fingers and palms. To remove it, avoid touching your skin with the outer part of the gloves. Gently pull it as you wrap it, thereby containing the dirt inside. Insert your ungloved finger inside the gloves of the opposite hand and gently pull it, ensuring that you wrap it along the way. Get a tissue or a paper and wrap it before throwing it in the trash bin. Having discussed the chain of infection, the proper way of hand hygiene, and the correct way of using PPE, do we ask ourselves, do we really need to be a nurse, a doctor, or a healthcare professional to become a frontliner?
By just knowing the basic nature of the disease and the proper way of protecting yourselves and the others around you, you can be a frontliner.
That's it for this episode. Thank you so much for watching. Don't forget to give this video a thumbs up and share it with your friends, your families, your colleagues, and your students. This has been Rommel Alegre Jr. Keep safe and stay healthy. May the PNU Talks be with you.